Welcome to this week's tip of the week. I'm Dr. Meagan von Holtz. Last time we talked a little bit about symptoms of temporomandibular joint dysfunction, or TMJD for short. This time I thought maybe I'd expand on that and then go over some ideas for treatment. So first thing, when someone comes into the office needing help, we always do a detailed history. Some of the things I might hear in someone who has TMJD in terms of their history is they may be talking about pain in their jaw, or popping or clicking, maybe headaches, maybe ear pain or feeling like it's full or itchy. Maybe they were in a car accident recently. Maybe they received a left hook. What about, even as simple as maybe you were cramming for your exams and you were holding your posture like this with your arm or your fist into that jaw for hours on end. Another thing that I actually hear a lot is people having trouble after dental work. Now, not that dental work is bad, but sometimes if you have to have your mouth open and to one side for the dentist to work a long time on one side, that can actually change the tension of the muscles and people get problems after that. So those are some of the things that I hear a lot. The second thing is we always have to do an exam, because the truth is you could have two people with very similar symptoms having a different diagnosis. What if someone has ear pain and headaches? That could be TMJD, but it could also be a sinus infection with an ear infection. So you really actually have to do an evaluation and figure it out. One of the things that I'll always look at if I suspect TMJD is that ring that we talked about last time. So these upper bones in your neck, the eustachian tube in your ear and your jaw, they're all so close together, and then on each side, they don't actually touch, but they're in very close proximity, and they share a lot of the same muscular attachments. So if one of those things is out of alignment, a lot of times it will move all of them out of alignment, which is why a lot of times you have symptoms in different areas: ear, neck, jaw. So I always look at that alignment. If the jaw itself does seem a little bit out of alignment, like maybe it opens more to one side, a lot of times in terms of treatment we'll use something like an activator, which delivers really fast, very gentle pulses right in here to the jaw to try to align that up correctly. The other thing, if someone has a lot of popping and clicking, that can be tougher because you could actually have damage to the actual disc inside there. If I hear that or feel that, or if I feel a lot of nodules in here, like the muscles are really tight, sometimes we'll use something like this RRT machine. It uses vibration to actually break up scar tissue, and it has this small applicator head, which really, that's a lot easier than these larger heads that we use for other conditions, but this can help a lot. The other thing I always look at, because we talked about those upper neck bones being so close, I look at the posture. A lot of us now, we're on our phones or computers and we're doing that bent forward posture. If your head is too far forward, it can put a lot of actual weight and pressure on that whole circular area. So if that's going on, then sometimes we'll do adjustments to the neck, but we'll also use a patented weighting technique called Pedimon. Now this is a beautiful crown, just kidding, that goes with that. But we actually have people wear this in the office on their heads for 10 or 20 minutes to help build the muscles to bring that posture back up to the center. Another thing actually that we use a lot with the TMJ is we do cold light laser treatment, which is really great because sometimes the jaw really hurts and you don't really want that much pressure on it. We use laser light, which is actually invisible to the eye, but if you shine that in an area, it's almost like, you wake up on a cloudy day and you're like, oh, let me go back to bed. You wake up on a sunny day and you're like, okay, let's go do something. That light does give you energy, so if we can give this area that needs to heal extra energy to heal, a lot of times that will make a big difference for people. Now, I know some of you are probably hoping, what can I do right this second to help, and none of this is really available for you. So some things you can think about is, one, use your brain to help your TMJ. I know that sounds silly, but don't do any unnecessary chewing. Like, don't chew on hard candy or ice or gum. You only really need to be chewing food that's absolutely necessary for survival. Don't do extra muscle work that's going to bother that more. Think about your posture too, like you don't want to be leaning on the jaw, and when you're reading or on your phone you really want to have your posture upright. Those are all some things that would be helpful for you as well. Hopefully you have found this helpful. Again, I'm Dr. Meagan von Holtz, and this was the tip of the week.